Good afternoon and welcome to Lexington Medical Center. My name is Jennifer Wilson and I'm the Public Relations Manager for Lexington Medical Center, for those of you who I have not met before. Today, Lexington Medical Center and Providence Hospitals are pleased to announce the terms of a significant agreement that the hospitals reached together that both believe will serve to enhance the delivery of health care to people in the Midlands. We're going to hear from several people today, and they're sitting here at the table. First, Mike Biediger, President and CEO of Lexington Medical Center. Thad Westbrook, the Chairman of the Lexington Medical Center Board of Directors. George Zara, Providence Hospital's President and CEO. And Michael Kapp, Chairman of Providence Hospital's Board of Trustees. First, I am going to give the microphone to Thad Westbrook.
Thank you, Jennifer. Welcome, everyone. Today we're pleased to tell you about an agreement between Lexington Medical Center and Providence Hospitals. It represents a tremendous step forward in enhancing healthcare delivery in the Midlands. As many of you know, there have been issues between our hospitals for the past several years, and we've had off and on discussions among our hospitals. But I want to give you some background to tell you about where we've been and to tell you how we got to the point that we are at today. A little more than a year ago, January 2008, we had a meeting with Michael Kapp, Sister Judith Ann, Mike Biediger, our immediate past chairman, Bill Stillwell, and me. We met at Providence Hospital and Sister Judith Ann's office. We had an opportunity to have a very open and frank discussion about the issues between our hospitals and what had been happening. We had an opportunity to talk about next steps and what we could do to continue a dialogue between our hospitals. From that, there were many more discussions. Michael Kapp and I developed a good relationship, a good working relationship, where we were communicating frequently during the past year to talk about our issues. George Zara joined us in May of 2008 as CEO of Providence Hospitals, and he joined the conversation working with Mike and his management team and talking about those same issues. Those discussions continued throughout the year, and in November of 2008, we started formal mediation. We had a total of 3 days of mediation, 2 days in November, and then on December 1st was our third and final day of mediation. Our mediator was Frank Mood. Frank is the general counsel for SCANA, and Frank hosted us for those mediation meetings at SCANA's offices, and he did all that free of charge. And it was a outstanding commitment to community service on his part, and really just wanting to make sure that these hospitals had an opportunity to talk and to move forward. Frank is here with us today, and I think he's sitting in the back. But again, publicly, we all want to thank Frank for his work and his willingness to help us. After we left Frank's, the mediations with Frank, we continued our discussions through December, into January, and then through February, and up till last week. And at that point, we had reached an agreement in principle, and we've executed an agreement. And I want to go through the terms with you, and then you're going to hear comments from Michael, Mike, and George. Under the terms of the agreement, Providence Hospitals will actively support Lexington Medical Center's efforts to secure an open heart surgery program through a joint certificate of need application filed with DHEC. Providence Hospitals will delicense one of its open heart surgery suites upon approval of that application, which will allow Lexington Medical Center to add an open heart surgery suite at Lexington Medical Center in keeping with the state health plan. In addition, Providence has agreed to support Lexington Medical Center's application for an emergency catheterization program and the addition of a new cath lab. Also, Lexington Medical Center, upon receiving a license to perform open heart surgery, will pay $5 million to Providence Hospitals. 1 year after being licensed to perform open heart surgery, Lexington Medical Center will make another $5 million payment. And then 2 years after being licensed to perform those surgeries, Lexington will make a third and final payment of $5 million for a total of $15 million to Providence Hospitals. In addition, Lexington Medical Center will drop its objections to Providence Hospital's efforts to expand Providence, Northeast. Those are the material terms of our agreement, and this represents a real opportunity for our hospitals to come together to better serve the patients in our community. In short, this represents a new day for our hospitals, and it's an exciting relationship and one that we're looking forward to developing in the future.
Thank you, Thad. My name is Michael Kapp. I serve as a volunteer. Currently, I'm chairman of the board of the Providence Hospitals. And Thad and I represent other trustees and volunteer board members that serve the Lexington Medical Center and serve Providence Hospitals. And to all of you, I want to thank you for your support, your encouragement, and your help in making this momentous event possible. Along with our staffs, our CEOs, who helped us craft this agreement that is going to be for the benefit of all the citizens of the Midlands, Lexington and Richland counties. We are very excited about the chance to turn what was a contentious relationship for a number of years into a partnership so that we can together move forward and increase and better the medical delivery systems in our two counties. We've got a wonderful partner in Lexington Medical Center who have a beautiful campus, do a wonderful job serving its patients. And we at Providence, who have probably one of the top heart programs in the country, are glad to be part of this partnership and assist in broadening and deepening the healthcare delivery to these two counties and the counties beyond us who also depend on our hospitals. It's been a long process. We've learned a lot about each other along the way, and all that is going to be for the best, because we are going to be able to collaborate on other things. We'll have other opportunities to work together for the betterment of our community and patients that we serve. I'm excited about it. Our board is excited about it. Our staff is excited about it. This is going to let us do some things that we've been needing to do. We feel like we've reached a very nice agreement that is fair to both parties and does things for both parties that were needed. And we're grateful to be at the point where we can turn this into action and move forward to help our communities. Thank you.